Peter Lamb, and I'm one of the physical therapists here at Barkman Smith Physical Therapy. Let's get started with our topic for this evening, the role of physical therapy in spinal stenosis rehab. Today, we're going to talk about spinal stenosis and how physical therapy can help you treat it. Now, because I have a lot of information that I want to share with you guys, I'm going to split this into two different videos. Today's video is going to talk more about neck and back pain in general, what is spinal stenosis, and the symptoms associated with it. Now, in the next video, I will talk about some potential treatment options that may help reduce pain caused by spinal stenosis. Now, before we talk about spinal stenosis, I want to talk about neck and back pain as a whole. Here are some statistics that I found as I was building this presentation. So did you know that 10 to 20% of the population has neck pain? That means 1 out of 5 to 10 people are having neck pain right now. And now. And now. Another thing that I found was that 80% of adults are estimated to experience low back pain in their lifetime. And that's 8 out of 10 people. That's a lot of people. And I will admit that I fall under that statistics because I have back pain in the past. But to those 2 out of 10 people who don't have back pain for the rest of their life, that's off to you. So the reason why I talked about neck and back pain in general and why I shared these statistics with you is because I definitely think that neck and back pain are very prevalent to our population as a whole. A lot of people are affected by it, and you're not alone whenever you do have neck or back pain. So there are many causes of spinal pain. Some causes of pain that physical therapy can help treat are more musculoskeletal of origin, such as a herniated disc, increased muscle tightness, increased joint stiffness, and today's topic, spinal stenosis. Now, however, there are also other things that cause spine pain where physical therapy won't be as effective, such as tummy problems, kidney problems, heart problems, or even cancer. Those things need to be addressed by a primary care physician, a medical specialist such as a cardiologist or a neurologist, or if severe enough, the emergency room. So if you guys are interested in learning more about the different causes of back pain, please comment down below so that we can incorporate that in our future live stream. Now, let's dive deeper into spinal stenosis. The first thing I want to talk about is just what is spinal stenosis? It's a big, scary word, I think, but spinal stenosis is basically a big fancy word that describes narrowing of the openings around the spine. Now, personally, I think a picture is worth 1,000 words, and I think rather than telling you what spinal stenosis is, I'd rather show it to you with my lumbar spine model. I guess you can say that I got my back. Okay, that's my punny joke of the day. Okay, so this is your lumbar spine. I'm gonna step a little bit closer, okay? This is the low back image of the spine. This is the front of it, this is the side, and this is the back of it. And do I need to go a little bit closer, Chaz, or when I get there? Okay. Perfect. So orientation-wise, if I'm facing forward, this is what it looks like, okay? This is what it looks like in the side, and this looks like in the back view, okay? So remember I told you, spinal stenosis is just a narrowing of the spine, okay? So quick anatomy lesson. You have your vertebrae, the big bones, the discs in between them, and then you have the nerves sticking out, okay? So all spinal stenosis is just this narrowing process. So if I kind of bring it a little closer, you see that as we get older, you know, this disc gets smaller as we grow older, and that the space between the two bones also gets smaller. And watch as I kind of bring it closer, it kind of creates that narrowing right there where that nerve is poking out. That's basically spinal stenosis. Now, this narrowing can cause compression on the nerve that branch out of the spine and run down the leg, okay? Now, one big thing I do want you guys to know who might have spinal stenosis is that this narrowing process is the natural aging process of our body. Unfortunately, we are not invincible, and as we all grow older, the integrity of our tissue is not what it used to be when we were younger, and that's normal. That's normal. Now, there are ways to help prolong or even speed up that narrowing process, such as your activity level, your diet, your lifestyle, and even genetics. All those are help determine whether you get spinal stenosis faster or slower, but in general, that's how we are made. But if I can figure out a way to find how we're all invincible, I'll definitely do another live stream on Facebook video on that part. So some of the symptoms associated with spinal stenosis are back and neck pain, stiffness and decreased range of motion, and you can also have symptoms that radiate down your arm and your leg, such as numbness, tingling, weakness, or you might even feel a slight jolt going down in a straight line to your toes and your fingers. Now, there are some telltale signs that are associated with spinal stenosis, okay? Some things that usually make your neck or back worse are things such as bending backwards, okay? Looking up, standing up, and even walking. Also, if you have pain going down one side, generally, if you side bend to the same side where that pain is, your pain will get worse. That radiating symptoms tend to get worse, okay? Now, some things that help reduce your pain are things kind of the opposite motion. So think of things like bending forward, like that, looking down, and kind of same idea. If you have radiating symptoms going down one side, if you bend away from the pain, it usually feels better, usually, okay? Now, there is a weird sign that is associated with low back stenosis that I like to call the shopping cart phenomenon, so I'll be right back. Have you ever noticed when you're walking down the grocery store and you're getting through your items, you're up the aisle, and you stand up tall, and when you stand up tall, your back starts to hurt a little bit. So typically, most people will actually kind of lean forward against the cart and actually makes their back feel better. Yeah. And that's what you call the spinal stenosis. Thank you, Kaylee, for letting me borrow your desk. I really appreciate it. Now, there is a reason why all these particular movements affect your back pain. There's a reason why bending backwards makes it worse, why looking up makes it worse, and the opposite movement makes it feel better, like bending forward or looking down. And part of it is because of the mechanics of the low back. But before I tell you about the mechanics, I want to wait to, you're going to have to tune in next time when I talk about ways to help battle spinal stenosis. Again, if you're interested in getting screened by a physical therapist to see if you have spinal stenosis, you can reach us by phone at 817-283-9435 or email info@barkmansmith.com.